Today we're doing another video in our series, and it's again on a subject we've talked about before, which is safety in cosmetic plastic surgery. Obviously, most of us who do primarily cosmetic or aesthetic surgery are singularly focused on making sure safety is number one. We want patients to know that we're doing everything possible to achieve their goal, but yet keep them safe. So what are some of the criteria you need to know about when it comes to making sure that if you entertain doing cosmetic plastic surgery, you'll be safe? Well, first, you have to choose a surgeon who you trust and who has credentials and a background that makes you confident that he's well-trained or she's well-trained and that they're going to take your best interest and put it number one. Second, you want to make sure that where you're doing your surgery, the facility, is a certified facility. And that's a question you directly ask the surgeon. You want to make sure it's a certified facility by one of the certifying bodies that certifies either an outpatient surgery center, an office surgery center in a doctor's office, and whether the hospital, if you're going to a hospital, is certified and credentialed. Second, you want to make sure that the anesthesia you receive to make you comfortable during the procedure, whether it's just sedation or a light general anesthetic, is administered by a competent and experienced anesthesia provider. It can be a nurse anesthetist. In our practice, we typically only use board-certified physician anesthesiologists because it's an added degree of safety with that extra training. Again, no judgment, but those are your options. And if you have the option to use a physician anesthesiology provider, we typically think that's a level of improvement in many cases. There's disagreements on that, but that's just one consideration when you're considering having the cosmetic surgery. And finally, you just want to make sure that the procedure you're doing, whatever it may be, carries a risk factor that you can accept, that you understand the risk factor with whatever procedure you're having. Large volume liposuction is a much different risk factor than a mini facelift. A breast augmentation is a different risk factor than a full tummy tuck. So you want to know the different risks associated with the surgery, and that's when you look the surgeon in the eye before you agree and you hear from them what the risks are. And you ask your questions and you have them answered. Those are the primary things to make sure that if you're having surgery, that you're not at risk and that you're balancing the risk and the benefit to achieve your goal.